Hi, my name is Rex and I am a dead man walking. And I want to share some of my story with you in the hope that it will be an encouragement to you or to someone else who has been affected by cancer. I want it to help or encourage you to give practical tips but also to let you know that you are not alone and that there is hope beyond what you or they can see right now. So last time we talked together, I shared about getting used to having an ostomy pouch or a stoma bag on my stomach from the Hartmann's and laparotomy procedure that had happened, and gave you a few tips, and I just shared some experiences there. Today I want to share what happened next, and that was the outcome of the surgeon and the lab findings from what they had cut out in the cancer, and then the decisions that had to be made following that around chemotherapy. So they cut the bits and pieces out. They cut out more than what was just obvious immediately, and that's standard practice, so that they can get a feel by analysing in the lab what they've cut out to see how far the cancer has travelled. And so they, for example, they cut out some lymph nodes and they sort of did a V shape downwards from the initial site of the cancer in my bowel. And so in the lab they just calculate how far it's gone out towards the edges, how many lymph nodes are involved, and in my case it was 3 out of the 13 that it had spread to that they found in the lab. So anyway, we were given a surgeon's appointment to discuss the findings from the lab report and from everything that they'd done so far. And the surgeon told me that it looked like they had got it all, and they couldn't see anything anywhere else in the body either. So the lab report showed 3 of the 13 lymph nodes were cancerous, but of course they had been cut out, including some additional lymph nodes. So, but they also recommended chemotherapy to mop up any small microscopic or small tumours or other places that cancer had spread to that might not be visible immediately at that time, and were perhaps too small to show on the CT scans. I had always had the idea in my mind, completely ignoramus, no experience with cancer whatsoever, but I had the idea that chemotherapy and radiotherapy and other cancer treatments were very cruel, and I had a natural aversion to them. Not that I had an alternative, and perhaps I entertained some natural alternatives, ideas in my mind, but it's funny how once you're in the situation and you don't have any clear alternatives, how a lot of things evaporate and you're just left with the main thing. For me, for a lot of people, I think that would be an easy decision. You just think, well, the doctor says this, I do this. For me, I found it a lot harder than perhaps most people do, and it was contributed to in large part by my uncertainty and my ignorance, both of mainstream cancer treatments and also of natural and alternative cancer treatments as well. I'm someone who likes evidence. I'm not into hopeful Harry type remedies, but I also have an open mind. So what the doctors and the oncologists told me was that under the circumstances, I may have no further cancer, or I may well have no further cancer at all, and that I may not need any chemotherapy or anything. And they gave me some some further information which I'll share in a moment. Regarding standard cancer treatments, I had concerns not just about the suffering of the cancer treatments themselves at the time, but also about long-term effects that would carry on beyond the treatment, particularly one called peripheral neuropathy, which is pain in your extremities and joints where it does permanent nerve damage. And sometimes that can come right after chemotherapy over a series of months, but sometimes it never does, and you can be afflicted by chronic pain from then on for the rest of your life. And the more I read, and this is what happens when you go on Google and the more stuff you read, the more apprehensive I became. For me, because I am confident of where I'm going to heaven when I die, and I'm confident that God is working things out for my best because my trust is in Him and I love Him and I know Him as my perfect Father and trust Him. I'm less worried about dying. I'm not desperate not to die, and so it's not like it was survival at any cost for me, and I didn't want to have a long miserable existence from treatments, especially followed by death afterwards if it wasn't successful. So at this time, of course, you're also thinking about things like your hopes and your dreams. I was 50 years old, and the surgeon said I was young. My children seem to think that's old. But there were many things that I longed for. So having children who were sort of 18, 19 years old, 17, 18 years old, and you long for to see your children get married, to walk your daughter down the aisle, to see them have children, to share in the joy of grandchildren, and not only that, there are things that I wanted to change, things that had not been right in life, that I had sort of chilled out a little bit over and thought, well, in good time, I will be able to work on these things where things are not right. And yet, here it was, I was all of a sudden potentially with a shorter leash of time in my life. So, as I share these things, it probably doesn't seem like a particularly big decision about chemotherapy to most people, but for me it was a really hard one with many potential negatives and uncertainties, no matter which way I went. And I was in real angst. It was something out of my control, which I'm not good with, and outside of my knowledge. I couldn't have certainty, and I didn't know how I could ever have peace about making that decision. I was not at peace at all with a decision in either direction. I wasn't at peace with just doing nothing. I wasn't at peace with going the full hog with chemotherapy. And I took this to God in prayer for many weeks, anguished prayer. I was really struggling with it. And but God really answered my prayer by giving me some very special oncologists who were patient. I so appreciated their professionalism and their patience as they worked through options with me in a caring and non-judgmental way, putting up with my ignorance and my apprehensions. And they explained answers to all my difficult questions, and it made all the difference to the experience, and ultimately it enabled me to make a decision which I did have peace about at the time, and which I am still at peace with today. And so from memory, the advice was that my chemotherapy would increase my likely 5-year survival rate from around 70% with no chemotherapy to around 83% with chemotherapy. So if I had no chemotherapy, maybe 70% chance of being alive in 5 years. but with chemotherapy maybe 83%, and that's if I did the whole lot, including both oral and the intravenous one that they do on a regular basis, which is quite rough on the system. In the end, I chose an option that had less severe potential immediate side effects, but the treatment would last for longer, so it would be 6 months instead of 3 months, but it also had a lesser chance of creating that peripheral neuropathy, that chronic debilitating pain in your extremities that I was concerned about. And by doing that, it would increase my 5-year survival rate to around about 79%, I think they said from memory. But on balance, that is what I was happy with. I was happy to forego the extra likelihood in return for not doing something that I thought would potentially just give me a very miserable chronic illness, even if it was successful later on. So some patients want to know as little as possible and just do what they're told. For me, I'm at the other end of the spectrum. I like to have all the details, and the sense of control helps me. It makes a real positive difference, and I hate the feeling of being given vague or incomplete information. It must be very hard for professionals working out what's the best balance for their patient. And all I can suggest is tell them how you like things in order to make it easier for them to help you. So in any case, God gave me the people and the absolute peace about the decision I made, and I still have that peace about it today. When I made the decision, one really good question that they asked me is they said, if this cancer comes back, will you still be happy with this decision that you're making? And I really appreciated their straight up approach, helping me to think it through and helping me to be accountable to myself about what that would mean, and would I be happy if the cancer came back that I still made the best decision in the circumstance. And another thing that made it easier as well was that the way that they operated here in our hospital, they had a liaison person in the oncology department who was assigned to me, knew all about my case, and they coordinated things for me, and they answered all my needy questions, and they acted as a liaison with expert oncologists, and she was a real wellspring of knowledge and compassion and just straight up information. And I cannot speak highly enough of the blessing that these people have been to me, and that they obviously are to everyone. And it's a very traumatic time for people, and to have that kind of care and expertise and just willingness to talk through things. I want to say to you guys, you are a real gift from God, and I pray for His blessing on you. I'm very thankful for you. So the decision was made, and it was on to starting chemotherapy, and so I was doing 6 months of what's called Capecitabine. So it wasn't intravenous, it was oral only, but it was for 6 months. I was very trepidatious about the side effects, not looking forward to them. And there were all sorts of rules, like washing my clothing, bedclothes, linen, all separately from the rest of the family because of the toxic nature of the drugs that were being taken. And to be honest, I actually felt quite hurt over that. I felt like an outcast in my own home. I'm not saying it was reasonable, but it is how I felt. And I would recommend in these situations to talk through with your family and to let them know in advance. Ask them to talk to you about things before making decisions, just so that you're part of it and you get to be cared for in it, to ensure they understand what's happening and that they don't have any unnecessary fear over the chemicals and that, but so that you are able to do things right and show love as well, and for you to keep showing them love too in your distress, because that's certainly a challenge for me. When I'm distressed, I often stop showing love, and it doesn't help anybody. So from the chemotherapy itself, I can't remember all the side effects, so I'm only going to share with you the main ones that stick out to me. And perhaps the two biggest ones, the first one was joint and bone pain. I'd get these stabbing pains in my joints and bones, and it felt like I was losing all the gelatine stuff inside the joints, getting old and rusty, and like it was bone against bone in my knees and elbows and stuff, and in my finger joints in particular. That's how it felt. Essentially, chemotherapy felt to me like my body aged 10 or 20 years in the space of a few months. And of course that's what it's doing. It's stopping your cells from doing the normal renewal of themselves, and of course it's stopping the cancer cells from doing that at the same time, but it does affect healthy cells. And so the other effect that I had that was perhaps reasonably debilitating was the red burning and blistering on my hands a little, but much more on the soles of my feet. And it was very important to get out and have exercise every day for my recovery. But it got to a point where I couldn't actually walk anymore because of the blistering and the redness and soreness on my soles of my feet, and so that was certainly an effect. Even for walking around the house, it was painful just to get around to the toilet and so forth. One thing that helped a lot there was just getting this clear, natural aloe vera gel and just lathering it on a few times a day. That made a real difference to that for me. I had another real blessing during this time, and that is my employer. I had an amazing employer, and so thankful for them. They showed me compassion. They looked after me. They sent special cards and well wishes and love. And so I took originally 2 weeks off work or thereabouts at the time of the emergency surgery when it was totally unexpected. But then they allowed me to work part-time from home as I was getting back on my feet, and I was able to work with some flexibility through the entire time that I was on chemotherapy. I was so very thankful, and I am so thankful to them today. It was a mercy that I didn't deserve, and it was a true gift. So after several months of chemotherapy, at the end of April, beginning of May 2024, I completed the chemotherapy, and it took quite some time. Once I stopped, I kind of expected to feel better immediately, and it was a lot slower than that. Now, even now, more than a year down the track since completing chemotherapy, there are effects still, but they're much improved. But it did take somewhere between sort of 3 and 9 months before things returned more to normal. And one thing in particular that did happen was that I didn't value enough the damage that had been done to my joints. And one particular project that I did, I was making some raised garden beds out of macrocarpa timber and using a rattle gun to do up the big bolts or the screws and so forth. And I think my elbow joint had been weakened by the chemotherapy, the gelatine and everything, and in using that impact rattle gun that day, I did myself some damage that stuck for at least a year. A lot of pain at night and everything. So having finished the chemotherapy, I was due for a 6-month surveillance scan and another look. So they decided they would also do a colonoscopy to have a proper look at the stomach, which of course they hadn't been able to look at because the initial surgery was emergency surgery in the context of my stomach being absolutely overloaded. So so that was the first time they got to do that. So 6 months after after 6 months after the surgery, when I finished the chemotherapy, I had both another CT scan for surveillance to check for any more cancer activity, and also a colonoscopy. And I'll share that experience with you next time, because that's another thing that me, being the fraidy cat that I am, was very, I didn't know what to think about the colonoscopy, and I was worried about that. An emerging theme, isn't it? So anyway, I hope that there's something in there that helps you if you're thinking about chemotherapy and having to make decisions, and being encouraged in finding the best path for you. There's other things you can do as well, either instead of or in addition to chemotherapy, and I'll share some of those about repurposed medicines and supplements and stuff that I did in another clip with you. But yeah, but I'm very thankful, and I just hope that there is something there that is of use to you, and that your road is easy, because it's not going to be an easy thing mentally to do chemotherapy or radiotherapy or whatever you're doing. And I might just share a special song in the comments for you as well. I needed to be feeling at peace and safe, and I was given that. So God bless you until next time, and I look forward to catching you then.